It was absolutely devastating because every delivery there is a high-risk delivery. By the time all of the mothers arrive, they're in trouble and they need help.
But how can one nurse halfway around the world do anything to help end a medical crisis?
I would probably equate it to medicine in the early 1900s. People were working without power for most of the day.
She knows because Deborah saw this firsthand while working for the Adara group, an international development group that supports communities in countries such as Nepal and Uganda.
Starting to see these very dedicated caregivers struggling with very, very limited resources.
When she returned to the UW NICU, her fellow caregivers gave Deborah hope for the situation at Kiwoko Hospital.
Really how we got our first start was from that very first community that kind of gathered around me and our mission.
Syringes, gauze, and ambi bags. These items and many more, all in abundant supply for deliveries at Seattle hospitals, normally end up in the trash.
And so my idea was, what if for a short period of time that we were able to save those critical pieces of supplies? And then we could basically bring them down to Uganda and start the training and start to turn those mortality rates around.
The outpouring of supplies became so overwhelming that Deborah very quickly realized this was more than she could handle alone.
And so we had this idea of a pack-a-thon, and we thought if we could all come together and pack for this common mission.
We are grateful for the pack-a-thon, really, because they say what we actually want, and then they pack for us.
From tiny diapers to full-sized incubators, they packed year after year, container after container, for 11 years and shipped them to Uganda.
But now when we are having incubators, we can now save babies, even of 800 grams, which we couldn't because they would die of cold.
800 grams is less than 2 pounds. A tiny baby now with a huge chance to live.
We are having incubators, we can now save babies.
With the supplies in place, the medical volunteers have the opportunity to change the outcomes of many newborns.
And they would come and they do the in-service training. They work hand in hand with the nurses, and then they train the trainers.
Anyone who had anything to do with newborn deliveries, no matter where you are, whether at the hospital or in the community or an outpatient, they would all go through the neonatal resuscitation program. None of them had any formal training at all in pediatrics, so we just began at the very, very basics and just sort of worked our way up.
All of them volunteers, giving up their vacations to go and lend a helping hand and making a world of difference.
All of the people that I've been involved with this organization are so devoted. They totally touched my heart and changed my life. And the gratitude that the mothers feel towards the nursing staff and towards me as a volunteer is just like nothing I've ever experienced.
With a world of support behind Deborah's idea, Kiwoko Hospital has now become a model for NICUs in other developing countries.
This is where we can implement quality care and see that we improve the newborn lives and mothers go back home happily.